Vital sign monitoring is an essential part of healthcare. Clinicians, nurses, and paramedics use them to quantify a patient's well-being. This is useful for monitoring their health over long periods of time, or assisting in diagnosis. One of the most common methods of conventional vital sign monitoring is the electrocardiogram, or ECG for short. It involves attaching sticky adhesive pads to various parts of your body that are hooked up to a machine with these long cables that measure your heart rate. If you've never been hooked up to an ECG, imagine being attached to a giant octopus while you're lying in bed. Doesn't sound very comfortable, right? Another useful vital sign is your breathing rate, which is in fact one of the most useful indicators of overall health. But many hospitals don't even bother tracking it, and those that do must either do it by hand or use a strap that wraps tightly around your chest. Patients in hospitals are already under a great deal of stress, and these uncomfortable restrictive devices aren't helping. This is where non-contact vital sign acquisition comes in, a way of getting those valuable numbers, heart rate and respiration rate, without having to attach cables to the patient. Here's how it works. Instead of electrodes and straps, we use a camera-based method. Your heart pumps blood through your body in bursts. When that blood reaches your extremities, for example your face, it causes a slight change in your skin color that's not really visible to the human eye. If you have a camera that's sensitive enough, it can analyze the timing of the color changes to obtain your heart rate. Not so complicated, right? But then how do we obtain breathing rate? For this, we use a special type of camera with two lenses. This allows it to use a process called triangulation to capture data in 3D. Kind of like how your two eyes allow you to see in 3 dimensions. When you breathe, your chest rises and falls as your lungs expand and contract. The camera is able to detect these movements and analyze them to get your breathing rate. Two methods of acquisition for two of the most important vital signs. There is still some work to be done, but soon, hospitalized patients will be able to enjoy the comfort of non-contact vital sign monitoring, so they can stop focusing on the machines and start focusing on their recovery.